For those patients who are far away, Life Flight is able to bring us those patients from the scene immediately. That can cut down transportation time. We know that for trauma patients, we have what's called the golden hour. If patients get to us within 60 minutes of being injured, they have the best chance of having a good outcome from their injury, best chance of surviving if they have a life-threatening injury. So getting them here quickly is helpful. Having new ambulance bays and a dedicated room where we can bring those patients directly into the room every time for our initial resuscitation and our initial evaluation. Sometimes that's where the most crucial life-saving procedures are performed, whether it's an actual procedure on the patients or the initiation of giving blood. And those trauma bays will be key to delivering cutting edge and current standard trauma care for our patients. As it is now, our patients land in any room sometimes. Sometimes it's a really small room. Sometimes we have to bring our carts from around the corner into the room where we're working. If you end up having to get an EMS gurney plus 3 or 4 providers, plus some nurses, plus a cart, plus an ultrasound machine, all into one of these tiny rooms, it makes it very crowded and very hard for us to deliver good care. It can become a safety issue, in fact, for the patient because it's so crowded. Our trauma bays now, where we take care of patients now, there's a nice curtain that hangs between two patients, and sometimes what we do is a little gory, and sometimes it's not what we want our sweet grandma next door to be listening to through the curtain. So it'll be fantastic having a large dedicated space for one patient.